Once again, for those who do not understand why it is necessary to wear a protective mask in public places. The World Health Organization and the Centers for Disease Control and Prevention recommend maintaining a certain distance between people to prevent the spread of COVID-19. These social distancing guidelines are based on various studies, but further research on the exact mechanism of virus transmission from one person to another is still needed. In the book, Physics of Fluids, published by AIP, researchers from Stony Brook University, Harvard, Zurich, and Hanyang University demonstrate that normal breathing indoors without a mask can carry saliva droplets capable of transporting viral particles up to 2.2 meters within 90 seconds. The use of a face mask significantly reduces the travel distance of these droplets. Almost 2 minutes later, saliva droplets contained by a mask traveled only 0.72 meters. The study employed computer modeling with a more realistic scenario compared to those used in previous studies. The previous work examined aerosol transport after coughing or sneezing, while this study specifically looked at normal human breathing. Normal breathing produces periodic jet streams containing droplets of saliva, but the velocity of these jets is less than 1/10 the speed of a cough or a sneeze. Researchers found that even during normal breathing, a complex field of vortices is formed that can carry saliva droplets away from a person's mouth. Ali Khosronejad, the lead author of the study, American Institute of Physics, explains in this regard, "Our results show that unmasked normal breathing generates periodic trailing jets and leading circular vortex rings that spread forward and interact with the vortex structures of the flow created in previous breathing cycles. This complex field of turbulence can transport aerosol droplets over considerable distances. A face mask dissipates the kinetic energy of the jet produced by exhaled air, disrupting the vortices and limiting the movement of virus-laden droplets." The researchers considered the effect of evaporation on saliva droplets. In the absence of a mask, they found that the droplets in the front of the exhaled air partially evaporated, reaching a size of just 1/10 of a micron. In stagnant air, droplets of that size would not settle on the ground for several days. The use of a mask partially redirects exhaled breath downward and significantly restricts the forward motion of the aerosol, thus substantially reducing the risk of suspended droplets remaining in the air. To simplify the breathing process, we did not consider the flow of the mixture of air and saliva through the nose and only accounted for the flow through the mouth, said Khosronejad. In future studies, we will investigate the effects of normal breathing through both the nose and mouth.